To another American Lung Association Lung Chat with our friends here at AdventHealth, and I'm really excited today to be talking to Dr. Tarver. You may have remembered we did a chat with him last year to talk a little bit about high-level hypertension for our lung disease patients. Today we're going to dive into another topic, which is CTEPH. But let's start off. How are you doing today, Dr. Tarver?
I'm doing great. Thanks for coming out.
No, thank you for having us. So CTEPH, what does that stand for? What is it?
So CTEPH stands for chronic thromboembolic pulmonary hypertension. And I think it makes sense maybe just to talk a few minutes about pulmonary hypertension because CTEPH is a subtype of that. So pulmonary hypertension is high blood pressure in the lungs. I think we often mistake that for regular high blood pressure. But the high blood pressure that we evaluate by putting a blood pressure cuff on your arm is blood pressure generated by the left side of your heart. When we talk about pulmonary hypertension, we talk about the right side of the heart pushing blood through blood vessels in the lungs, and that's pulmonary hypertension. CTEPH is one of the 5 different types of pulmonary hypertension.
I didn't realize there were so many types of different hypertension. We'll have to do some more lung chats to dive into each of those. But all right, so with CTEPH, what are the signs and the symptoms of that?
So in any form of pulmonary hypertension, the predominant symptom is feeling short of breath. It's intolerance of activity, so people who try to walk, climb stairs, even do laundry may feel out of breath, may feel fatigued, may feel worn out. In advanced cases, patients may experience chest pain, they may experience passing out, swelling in their legs, even swelling in their belly. So early on, shortness of breath that's unexplained is something that we like to think about when it comes to pulmonary hypertension.
And curious too, what kind of age ranges do you tend to see with the exhibiting of these symptoms?
So that can be a wide age range, and the age ranges tend to differ based on the underlying cause of pulmonary hypertension. Here in our CTEPH program, we've seen people in their 80s. We've also seen people as young as in their 20s. The thing about CTEPH is that it is caused by blood clots that usually form in the legs or in the arms and then travel into the blood vessels in the lungs and clog them up. And so that can occur at any age. So there may be people who are predisposed to that because they've got abnormalities of the way they clot their blood. There may be people predisposed to that because they're immobile for long periods of time, broken leg, for example, and they're in a cast and not moving for a couple of weeks. You can form a blood clot in your leg that can move on to the blood vessels in the lungs. So wide range of ages because everyone really could have one of these risk factors.
I appreciate you diving into that a little bit for me. I think sometimes when we talk about hypertension or anything related to that we might have a certain image in our head of, maybe what that person may look like. And I think it's important for us to understand it's a little bit more broad. So what are some of those risk factors? I feel like you kind of dove into that a little bit when we talked about age range, but any other specific risk factors?
So certainly I would say anyone who has already had a blood clot in their legs or a blood clot in their lungs is at risk for developing a long-term complication of pulmonary hypertension if those blood clots don't resolve. People who are at higher risk for forming blood clots in general might be people who have an inborn error of the way that they clot their blood. They abnormally clot. And so sometimes that's a genetic thing. Sometimes that's associated with other diseases like connective tissue disease. Lupus is one of those diseases that predisposes people to these problems. Again, people who are immobile for long periods of time. Sometimes we see this after, say, people have hip surgery. There's a very high risk of that after hip or knee surgery to the point that it's now routine to actually put people on blood thinners around the time of that type of surgery to prevent that from happening. So it is less likely, but certainly can occur if people take extremely long plane flights, those sorts of things. And that's why there is a pretty strong recommendation if you're traveling for long distances, You stay hydrated, you get up, you move around. During that flight, that dramatically cuts the risk of developing a clot because of that.
I know our constituents will really appreciate learning a little bit more about that. And so now let's say somebody is diagnosed with CTEPH or anything like that. What are the treatment options?
So with CTEPH, first off, I think is making the diagnosis. That's the really important thing. So we know that about 4% of people who have an acute blood clot in their lungs never fully resolve it and go on to develop CTEPH. So it's really important that if you've had a blood clot and you've been treated appropriately and you don't get back to your baseline level of functioning, we need to look for CTEPH. Once that diagnosis is established, by far the best option for that is surgery. So there's a very specialized surgery called a PTE. It stands for pulmonary thromboendarterectomy. It's a mouthful, so we call it PTE. I try to say that as few times as I can. But PTE surgery can be curative for this. Most of us think about blood clots as soft, mushy things. But over time, if a blood clot stays fixed and doesn't resolve, it actually turns into more like fibrous tissue. It's hard. And so you can't just suck that out with a syringe or something like that. You actually have to dissect that out from the opening of the artery. And it's highly specialized, and very few surgeons are actually trained to do that. We're fortunate to have Dr. Dwayne Davis here, who has been doing this for decades and is probably one of the most highly trained surgeons in this field in the country. So that is the first line of therapy. There are going to be some people who don't have clots that are accessible by surgery. And for those people, there are certain medications that can be used, but those medicines are not first line. They're only for people who don't have that surgical option.
Well, that's all very interesting and really wonderful information for our Lung Association constituents and anybody else watching. Is there anything else that you would like to add about CTEPH, or especially tell people how they can find you?
Certainly. So I think the most important thing is that we need to think about it. So anybody who's had a blood clot who doesn't improve and doesn't get back to where they were before the blood clot in terms of activity tolerance should be talking with their doctors about that complication. And the best way to screen for that is going to be an echocardiogram. And from there, if that's abnormal, then being referred to a CTEPH center. So we can be found here at AdventHealth, and we're available on the web. Our clinic is called the Advanced Lung Disease program here at AdventHealth, and we are happy to see people with this, whether it's diagnosed or suspected. So please don't hesitate to reach out to us.
Fantastic. And we will include some links at the end of this video so that you can learn a little bit more about that. And of course, for those of you following on social media, if you have questions, you are welcome to message us. We'll be happy to put you in touch with our great friends here at AdventHealth. Dr. Tarver, thank you so much for giving us a little insight on CTEPH. We'll look forward to the next one.
All right, thank you very much.
Thank you.